In the tumultuous years of the early 1960s, a bold idea emerged from the heart of the United States, a nation brimming with optimism and a sense of global responsibility. This idea was to harness the nation's prosperity to uplift the developing world. This grand vision gave birth to the United States Agency for International Development, or USAID, in 1961, under the leadership of President John F. Kennedy. USAID was tasked with a monumental mission: to extend a helping hand to countries grappling with poverty, hunger, and instability, aiming to create a more stable and prosperous world. From its inception, USAID has been deeply intertwined with the foreign policy objectives of the United States, often serving as an instrument of soft power in a world increasingly fractured by ideological divides. USAID's scope of work is vast and multifaceted, encompassing a wide array of sectors crucial for human development. These include health, education, agriculture, democracy and governance, economic growth, and humanitarian assistance. In the health sector, USAID has been instrumental in combating diseases such as HIV/AIDS, malaria, and tuberculosis, while also improving maternal and child health. In education, the agency has worked tirelessly to increase access to quality education for children and adults alike. With a presence in over 100 countries, USAID partners with governments, civil society organizations, and local communities to implement programs designed to foster sustainable development and improve the lives of millions. Over the decades, USAID has played a pivotal role in responding to some of the world's most pressing challenges, from combating infectious diseases to supporting disaster relief efforts and promoting economic development. USAID's work is not merely about providing aid, it's about empowering nations to chart their own course towards self-reliance. This is often achieved through capacity building, technical assistance, and promoting good governance. By focusing on these areas, USAID aims to create lasting change that enables communities to thrive long after the initial aid has been provided. USAID's ultimate goal is to create a world where poverty and suffering are replaced by opportunity and prosperity, a world where every individual has the chance to live a healthy, productive, and fulfilling life. However, USAID's journey has not been without its share of controversy. Critics argue that the agency's operations are often entangled with U.S. foreign policy interests, leading to accusations of political bias and a lack of neutrality. Others point to instances of inefficiency and a failure to achieve lasting impact, raising questions about the effectiveness of its aid model. Despite these criticisms, USAID remains a formidable force in the realm of international development. The agency continues to wield significant influence and resources that have undoubtedly shaped the global landscape, striving to adapt and improve its strategies to meet the evolving needs of the world. As the world faces new challenges, from climate change to global pandemics, USAID's role in fostering international cooperation and development remains as crucial as ever. Through its ongoing efforts, USAID seeks to build a more just and equitable world, where every nation has the opportunity to achieve sustainable development and prosperity. The legacy of USAID is one of hope, resilience, and a steadfast commitment to making the world a better place for all. Nowhere is USAID's impact more evident than in the realm of global health. The agency's initiatives have touched countless lives, bringing hope and healing to communities in need. The agency has been at the forefront of the fight against some of the world's deadliest diseases, including HIV/AIDS, malaria, and tuberculosis. Through its comprehensive programs, USAID has provided critical resources and support to healthcare systems worldwide. USAID's efforts have resulted in millions of lives saved, countless illnesses prevented, and a brighter future for families and communities around the world. The agency's work has not only improved health outcomes but also fostered resilience and self-reliance in vulnerable populations. One of USAID's most notable achievements in global health has been its pivotal role in the President's Emergency Plan for AIDS Relief, or PEPFAR. This landmark initiative has transformed the global response to HIV/AIDS. Launched in 2003, PEPFAR has provided billions of dollars in funding for HIV/AIDS prevention, treatment, and care programs in heavily affected countries. This funding has enabled the establishment of robust healthcare infrastructures and the delivery of life-saving services. USAID's contributions to PEPFAR have been instrumental in expanding access to antiretroviral therapy, reducing mother-to-child transmission of HIV, and providing essential care and support to those living with the virus. These efforts have significantly improved the quality of life for millions of people. Beyond HIV/AIDS, USAID has made significant strides in combating other infectious diseases. The agency's comprehensive approach addresses both prevention and treatment, ensuring that communities are well equipped to manage health challenges. The agency's support for malaria prevention and treatment programs, including the distribution of insecticide-treated bed nets and access to effective anti-malarial drugs, has led to a dramatic reduction in malaria-related deaths in recent years. These initiatives have been particularly impactful in regions with high malaria prevalence. Similarly, USAID's investments in tuberculosis control programs have helped to improve detection, diagnosis, and treatment of the disease, contributing to a decline in global tuberculosis incidence. The agency's efforts have strengthened local capacities to manage and mitigate the impact of tuberculosis. USAID's commitment to global health extends beyond combating specific diseases. The agency's holistic approach encompasses a wide range of health interventions and support systems. The agency also plays a crucial role in strengthening health systems in developing countries, supporting maternal and child health initiatives, and improving access to clean water and sanitation facilities. These efforts are essential for building sustainable health infrastructures. Through these multifaceted efforts, USAID is working to create a healthier and more equitable world for all. The agency's dedication to global health is a testament to its mission of fostering a better future for generations to come. Education is the cornerstone of progress, the foundation upon which individuals and societies can build a brighter future. Recognizing this fundamental truth, USAID has made education a cornerstone of its development agenda, investing billions of dollars to expand access to quality education for children and youth in developing countries. From primary schools to universities, USAID's support is helping to unlock the potential of future generations, empowering them to become agents of change in their communities. One of USAID's key priorities in education is to improve literacy rates, particularly among girls. The agency supports programs that train teachers, develop culturally relevant learning materials, and promote girls' education by addressing barriers such as school fees and cultural norms that discourage girls' enrollment. By investing in girls' education, USAID is not only empowering individuals, but also contributing to broader societal advancements, as educated girls are more likely to lead healthier, more productive lives and raise healthier families. Beyond basic literacy, USAID is also committed to improving the quality of education at all levels. The agency supports programs that strengthen teacher training, develop relevant curricula, and provide essential learning materials to schools in underserved communities. Furthermore, USAID recognizes the transformative power of technology in education. USAID is supporting the integration of technology into classrooms, providing access to computers, internet connectivity, and digital learning resources. By bridging the digital divide, USAID is equipping students with the skills and knowledge they need to thrive in an increasingly interconnected world. Natural disasters can strike suddenly and without warning, leaving a trail of devastation in their wake. These catastrophic events can disrupt lives, destroy homes, and dismantle entire communities in a matter of moments. In the face of such calamities, USAID serves as a beacon of hope, providing swift and effective humanitarian assistance to those in need. Their dedicated teams work around the clock to ensure that help reaches the most vulnerable as quickly as possible. From earthquakes to hurricanes to famines, USAID is often among the first responders, delivering life-saving aid and working tirelessly to alleviate suffering and rebuild shattered communities. Their presence is a testament to their commitment to global humanitarian efforts. USAID's disaster relief efforts encompass a wide range of activities, including providing emergency food, water, and shelter. These essential supplies are critical in the immediate aftermath of a disaster, helping to stabilize affected populations, and medical supplies to those affected by disasters. Access to medical care is often severely limited during such times, making USAID's role in delivering health services indispensable. The agency also works to restore access to essential services such as sanitation and healthcare, which are crucial for preventing disease outbreaks and ensuring the well-being of affected communities, and supports the rehabilitation of damaged infrastructure, including roads. Rebuilding these vital links helps to reconnect communities and facilitate the delivery of further aid. bridges, and schools. Restoring educational facilities is particularly important for the long-term recovery and stability of affected areas, providing children with a sense of normalcy and hope for the future. USAID's disaster response is guided by the principles of humanity, neutrality, impartiality, and independence, ensuring that aid is delivered solely on the basis of need, regardless of political or other considerations. This approach helps to build trust and ensure that assistance reaches those who need it most. In recent years, USAID has played a critical role in responding to major disasters around the world, including the 2010 Haiti earthquake, where their efforts were instrumental in providing immediate relief and supporting long-term recovery. The 2015 Nepal earthquake, which saw USAID mobilizing resources and expertise to assist in the aftermath of the devastating tremors, and the ongoing humanitarian crisis in Yemen, where USAID continues to provide critical support amidst complex and challenging conditions. USAID's swift and effective response to these disasters has saved countless lives and provided a lifeline to millions affected by these tragedies. Their efforts have not only addressed immediate needs but also laid the groundwork for sustainable recovery. In addition to its immediate disaster relief efforts, USAID is also committed to building long-term resilience to disasters. This involves working with communities to strengthen their capacity to withstand future shocks. The agency supports programs that strengthen disaster preparedness, early warning systems, and community-based disaster risk reduction initiatives. These proactive measures are essential for minimizing the impact of future disasters. By investing in these preventative measures, USAID is helping to mitigate the impact of future disasters and build more resilient communities. Their work ensures that when disaster strikes, communities are better prepared and more capable of responding effectively. Through these comprehensive efforts, USAID not only addresses the immediate aftermath of disasters, but also fosters long-term resilience, ensuring that communities can recover, rebuild, and thrive in the face of future challenges.